Thank you, and thanks to the wonderful introduction to the topic from the other speakers. So I'm presenting obviously from the Animal Health Australia perspective. So Animal Health Australia is a member organisation, and so we have Australian government and state and territory government members, as well as livestock industry and associate members. And we work across a range of different key work areas. So in the emergency preparedness and response space, animal health and biosecurity, as well as surveillance and diagnostics. But in the interest of time today, I'm going to talk about the core responsibilities of Animal Health Australia in emergency preparedness and in managing response. So I will speak to them in the context, obviously, of HPAI. I am talking a little bit more broadly than H5, but obviously H5 comes under the umbrella of that. So one of the core responsibilities of Animal Health Australia is as the custodians of the Emergency Animal Disease Response Agreement, or the EADRA. And that is a contractual arrangement between Australia's government and industry groups. And basically what it does is it sets out the arrangements for how an emergency animal disease response, in this case we're talking about HPAI, would be managed in Australia, and in particular the cost sharing agreement. And they have a number of parties to the Emergency Animal Disease Response Agreement, which includes the Commonwealth and all the states and territories, industry associations, and also Animal Health Australia ourselves as the custodians of that particular agreement. And underneath that, and this is where my role fits in as the head of program for AusVet Plan, but underneath and supporting the EADRA is the AusVet Plan, or the Australian Veterinary Emergency Plan. And that's a series of manuals that basically sets out the national policy and the guidelines for how a emergency animal disease response would be conducted. And all of the diseases that are listed under the ADRA have a level of AusVet plan that supports them. And so some of them have a response policy brief, whereas others have a full detailed response strategy. And so avian influenza has a response strategy of its own. And that's where I mentioned that I'm sort of touching on HPAI, including H5, because when we talk about the AusVet plan for avian influenza, it does cover any form of HPAI outbreak, including H5, and it does also touch on low pathogenicity avian influenza as well. So just for that context. And these are public documents, so they're available on our website. And Animal Health Australia plays the role of custodian of managing these. We don't set the policy. The policy is set by the members, but it's eventually endorsed by the Animal Health Committee. And we have a series of stakeholders that contribute to the development and upkeep of these plans across industry and government and other touch points as well to contribute to various parts of the manuals. And so we have a published version on the website of the avian influenza manual, but this one is currently undergoing a review. So it's been reworked and taking on board feedback from previous responses that have happened. So there's been HPAI, not H5, but other HPAI outbreaks in Australia that we've incorporated the learnings from, as well as obviously updated knowledge on the global situation and other scientific information. So it's undergone a major rewrite, and that's currently going through the approvals process at the moment. We also have other manuals that support or would support a response, such as operational manuals for destruction, disposal, decontamination. And in the context of HPAI, in terms of the poultry industry, we have an enterprise manual, and that's due for an update in the next financial year as well. So we're working on that one. And I just wanted to touch on, I guess, under the EADRA and with AusVet plan processes, how a HPAI response would be coordinated, just sort of broadly speaking, in Australia. So if there was reports of signs of HPAI, then that would be notified to the state chief veterinary officer. And if they had a high level of suspicion or it was confirmed, then the Australian Chief Veterinary Officer would be informed. And they would then convene the Consultative Committee on Emergency Animal Diseases, or CCEAD. and they are responsible for reviewing and recommending an emergency animal disease response plan, and that's developed by the affected jurisdiction. And an important point to note is that the affected jurisdiction is the one that manages and is responsible for managing the outbreak in their particular jurisdiction. And obviously, if there's multiple affected jurisdictions, they're each responsible for their particular area, and they each develop an emergency animal disease response plan, which gets reviewed and recommended by CCAD. And then the National Management Group is responsible for the financial decisions and recommending or approving cost sharing and then the financial aspects of that. So I just wanted to touch on how those structures work and sit underneath that EADRA that Animal Health Australia is responsible for. And just a little bit more on that so you can sort of see that visually and how that might work for the jurisdictions and those connections and how that information flow works. You can see the CCAD and NMG, and they're then responsible up to the agricultural ministers and also importantly out to industry as well. So through the peak industry body, both information going out and coming into them. And then within the jurisdiction, they will have, they set up a state coordination centre and often a local control centre as well, which would be closer to where the actual outbreak is. And then they have the structures underneath that to manage the various aspects of the outbreak. And very important within that is that they have industry input and also information flow out to industry as well. And obviously, I don't have time today to go into lots of the details of how this would work in terms of an emergency animal disease response for HPAI, but I just wanted to touch on some of the broad themes that AusVet plan covers. And so you can see the circle, and that's obviously a graphical representation of what some of the controls might look like in terms of the default policy. So we have a restricted area that would be in place around infected premises if identified in commercial poultry. And then we have a buffer zone or control area, and they're termed declared areas, the RA and the CA. And then the outside area is the area that we don't believe there is disease present or assumed to be free of disease. And then we'll have varying levels of controls and activities such as tracing and surveillance happening in those areas to, you know, ideally start understand where the disease has gone and where it's present, where it came from, if we can identify that, and to slowly try and reduce down that area. And so we know really where the disease is present. And we're talking about commercial premises. And so, as I touched on before, in terms of Australia's freedom in commercial poultry, the World Organization of Animal Health terms commercial poultry, we can go for freedom even if there's disease or pathogen present in wildlife. And so that's this default policy for is destruction or stamping out in commercial poultry. And so that's where the destruction and then disposal and decontamination aspects come in to try and achieve freedom from the disease in the livestock population. And then obviously public awareness and media plays a really important role in that as well. And others have touched on training. So Animal Health Australia supports training as well, through from resources online through to face-to-face training, particularly around our key responsibilities and CCAD, NMG and other aspects. We also have a National Biosecurity Response Team training. And there's lots of resources available online to have a look at. And I guess the main one I wanted to draw your attention to, which has already been put forward, but just to end on that, is with regard to our EAD online foundation course. So thank you very much.